Welcome back guys. Now in this video, let's discuss about left ventricular pressure volume loops. In the name itself it is there. We are discussing about left ventricle and we are also going to plot a graph between left ventricular pressure and left ventricle volumes. See, here are the volumes in the left ventricle on this x-axis and here are the volumes of the left ventricle on the y-axis. Okay, so we are going to plot a graph between a loop. See, it's a loop between left ventricular volumes and left ventricular pressures. We have already discussed what are the pressure changes in the left ventricle and we also know what are the volume changes in the left ventricle. Now let's start from something like this. Now left ventricle is relaxed. Okay, left ventricle is contracted. Now it is relaxed. Now after contraction, what is the amount of blood which is present inside the left ventricle? It's the end systolic volume. So at the end of the systole, see, only about 50 ml of blood is present. See here, let's start from this point. Okay, this point is the ESV means end systolic volume. How much amount of blood is there? Somewhere around 50 ml. Okay, 50 ml of blood is there in the ventricle. We know this. Now ventricle is relaxed. Now it have to fill with the blood or not? Now ventricle have to fill with the blood. Okay, so rapid ventricular filling, slow ventricular filling, atrial contraction, all of them will contribute to filling of the ventricles. Now that is the reason why, see, ventricular volume is increasing. Now ventricular volume from 50 ml, it is going to 120 ml, sometimes 140 ml, 120 to 140 ml. What is that? That is nothing but the end diastolic volume. This point is end diastolic volume. How much? 120 ml is now filling in the ventricle. Now my question to you is, ventricle is relaxed. Is there any pressure change right now? Is there any pressure change? See, there is no pressure change, only volume change. Graph is moving from left to right. Graph is moving from left to right. I am plotting this. So what is the event happening between the point A to C? Between the point A to C, what is happening? Left ventricle is filling. Okay. At the point C, now when the ventricle is filled, now what should be the function of ventricle? Ventricle is having 120 ml of blood. Now what it have to do? It have to contract. Now when ventricle starts to contract, isovolumetric contraction. When ventricle starts to contract, what is the first event? The first phase of isovolumetric contraction or the first event in the isovolumetric contraction is closure of mitral valve and tricuspid valve, creating S1 heart sound. So mitral valve should have to contract, like close or not? Yes, mitral valve have to close here. See, that's the reason why at the point number C, mitral valve is closing. When the end diastolic volume reaches 120 ml, now when the ventricle starts to contract, immediately mitral valve close. So at the point number C, what is happening? Mitral valve is closing. Now what will happen? Now after isovolumetric contraction, see, now isovolumetric contraction is started. No blood is coming in, no blood is going out. So is there any volume change now? So there is no volume change. So that's why graph is not moving towards right side or not even graph is going towards left side. Simply see, now graph is straight. Okay, there is no volume change. But what is changing? Now pressure is changing. See, graph is moving like this above. See, now the pressure inside the left ventricle from 0 it is going to 20, 20 to 40, 40 to 60, 60 to 80. See, something like that. Now pressure in the left ventricle is moving. Okay, so what is this phase? This violet color line is isovolumetric contraction from the point number C to point number D. What is exactly happening? From point number C to point number D, the mitral valve is closing and isovolumetric contraction is happening. Increases the left ventricular pressure while volume remains unchanged. There is no change in the volume of the ventricle. There is no change in the volume of blood which is present inside the ventricle. So no volume change but only pressure change. Okay. Now after this, when the pressure reaches 81, for example, now at 81, what is the event happens? Isovolumetric contraction ends with the opening of aortic valve. When the aortic valve is opened, isovolumetric contraction is completed. Now what will happen? Now from 81 to 120, pressure will increase or not? Yes, pressure is increasing. So that's why see, pressure is now moving from 81 to almost 120 mmHg. Pressure is increasing. So that's why see this green color line which I am showing you from point number D to point number E, what is the events happening? Pressure is increasing But also remember, the graph is now slightly falling towards left, which means volume change is also there, pressure change is also there, both are there. See, graph is moving up, which means pressure is increasing, and also graph is moving towards the left, which means, see, volume is now changing. Which volume? Ventricular volume is changing, which means the volume in the ventricle is coming down. Initially, how much volume, how much amount of blood is there inside the ventricle? Somewhere around 120 ml blood. But during rapid ejection phase, now blood is going into the aorta, right? So automatically left ventricular volume decreases or not? The amount of blood inside the ventricle decreases or not? So this phase is called as a rapid ejection phase, when the pressure change from 81 mmHg to 120 mmHg. So there is a rapid ejection of blood. Actually here, like I am showing you exactly in the middle, but actually this point should have to come somewhere over here. Like see, 2/3 of the blood, okay, 2/3 of the blood is going to be ejected. 2/3 of the blood will be ejected. This is the rapid ejection phase. Now later what happens, sir? After that, the pressure now will fall from 120 to 80 mmHg. So pressure change is there. See, pressure is falling down from 120, pressure is coming down, as well as the volume change also. Volume is also now changing, volume is also decreasing. See, during slow ejection phase also, some amount of blood, 1/3 of the stroke volume is going into the aorta, right? So again, left ventricular volume is decreasing. Left ventricular volume means like the volume of blood inside the left ventricle is decreasing. So that's why even pressure is coming down. Okay, it's not coming down straight like this. The graph is still coming towards the left, which means the volume is also coming down like this. Volume is also now coming down. Okay, so this is the slow ejection phase. Now later what happens? When the pressure comes below 80, now when the pressure, when it comes to 79, immediately what will happen? Aortic valve closes. Okay, that's the protodiastole. Immediately aortic valve now will close. So the phase between E to F, A, B, C, D, E, F, something like that. Okay, E to F, this phase is called as a slow ejection phase, where there is decrease in the left ventricular volume as well as decrease in the left ventricular pressure. Okay, so slow ejection phase is completed. After slow ejection phase, which phase is present? Slow ejection. After slow ejection phase, now what do we have? We have isovolumetric relaxation. After protodiastole, we have isovolumetric relaxation. See, from here isovolumetric relaxation is happening. What is isovolumetric relaxation? No change in the volume of blood. There is no voluminous change, only pressure change, right? So that's why graph is not going towards left or not going towards the right. Okay, see, simply only it is coming down straight ahead, it's coming down. So only pressure is falling down without any change in the volume. So isovolumetric, okay, isovolumetric relaxation. So the pressure is falling down from 80, I should say from 79, it is coming to 60, 60 to 50, 50 to 40, 40 to 20, 20 to 10, something like that. Okay, pressure is again almost, it will come to almost 0, it will come to 0. Okay, so when the pressure in the ventricle, when it is less than the atrial pressure, okay, when the pressure in the left ventricle, when it becomes less than the left atrial pressure, what will happen? Mitral valve opens. Okay, mitral valve opens. So that's the reason why, see here at this point, mitral valve opens. When mitral valve opens, again left ventricular filling will happen. Okay, so in just a summary, I can say, sir, the events which are happening from A to C. Okay, they will only ask you this, from A to C, what is happening? Left ventricular filling is happening. Okay. So left ventricle is getting filled because of the rapid ventricular filling, slow ventricular filling, as well as because of the atrial contraction, ventricle is filling, ventricular filling is happening. So volume change is seen here. Once the ventricle is filled, it have to undergo contraction. First phase of contraction is isovolumetric contraction. So here is the isovolumetric contraction. There is no volume change, but only pressure change from, like from 0 to almost 80, pressure change. Now once the pressure 81 is attained, aortic valve is going to be opened. So there is rapid ejection first, followed by slow ejection. Once after slow ejection, what will happen? Again, isovolumetric relaxation. Now ventricle is relaxing. Now same, again pressure is coming down. So it's forming a loop, guys. So this is left ventricular pressure and volume changes. We are forming a loop. So this is left ventricular pressure volume loop. All the explanations which are happening, I have already discussed here. Okay, what and all I have discussed, just I kept it here. Okay, for example, see, now what is the event which is happening from F to A? F to A, this is isovolumetric relaxation. So please concentrate, F to A, there is isovolumetric relaxation. E to F. E to F, there is slow ejection phase. Okay, see, pressure is falling, pressure it falls, okay, and ejection of blood slows. Actually it's falls, okay, it's not fails, falls. Pressure falls and ejection of blood also slows down. Okay, now let me correct it here. Pressure falls. Okay, pressure is falling down and ejection of the blood is also coming down. That's the slow ejection phase. And what is D to E? Okay, D to E is the rapid ejection phase. D to E, what is happening? There is rapid ejection. The aortic wall opens, see, aortic wall opens and the contracting ventricle ejects the blood into the aorta, okay, which reduces its blood volume. Yes, I have discussed with you, in the left ventricle, volume of blood goes down, right? Volume of blood goes down. Why? Because blood is ejecting into the aorta. Okay, so there is volume change. Okay, see, volume, like the graph is moving towards the left, which means volume is decreasing, okay. So with this, all the events of the left ventricular pressure volume loops are completed. This is something absolutely normal. Now let's see two important scenarios. Okay, at least you have to know these two important scenarios for your exam. For example, what happens in the condition of aortic stenosis, sir? See, this black color curve which I am showing you, okay, this black color curve is something absolutely normal. Okay, just wait. Before this, I just want you to know one more important point. The difference between end systolic volume and end diastolic volume is nothing but the stroke volume. The difference between end systolic volume and end diastolic volume is the stroke volume. For example, think, what is the end systolic volume? End systolic volume is 120. What is the end diastolic volume? End and diastolic volume, how much? 120. What is the end systolic volume? End systolic volume is 50. End diastolic volume means how much is getting filled, like during relaxation, how much ventricles are filling. End systolic volume means after the contraction of ventricles, how much ml of blood is present. This is 120 ml of blood, this is 50 ml of blood. So what is the difference? 70 ml. We know the 70 ml is the stroke volume, right? 70 ml of blood is going to come out of the heart with every beat, 70 ml. So the difference between end systolic volume and end diastolic volume, this difference is called as the stroke volume. Okay, now why I have discussed this is because, like this time the same question will come in the next slide. You please concentrate here. In aortic stenosis, what are the changes that you will see with the left ventricular pressure volume loop? Okay, what type of changes we will see, sir? See, this black color curve is absolutely normal. Okay, absolutely normal. See, in aortic stenosis, my questions to you. What is the problem? Aortic valve is stenosed. So there is a pathology that there is outflow tract obstruction. Blood is not moving from the left ventricle into aorta. So because of this, what happens? See, as there is an outflow tract obstruction, now left ventricle, what it have to do? It have to generate more pressure. Left ventricle have to contract more powerfully. It have to generate more pressure to send the blood. Because there is an obstruction, right? Left ventricle have to contract more pressure to send all the blood. So that's why, see, left ventricle, instead of producing 120 mm Hg pressure, it is generating 200 mm Hg pressure. When you see such a tall left ventricular pressure volume loop, that is aortic stenosis only. Okay, in aortic stenosis only you will have such a long, tall left ventricular pressure volume loop. Okay, so it is generating so much amount of pressure. Okay, now due to outflow tract obstruction, stroke volume decreases, so end systolic volume increases. Now outflow tract is obstructed. Now, do you think all the blood is going to go out? The blood is not going out. Okay, the blood is not going out. When the blood is not going out, okay, what will be the amount of blood which is present in the ventricle at the end of contraction? Blood is not going out. So, lot of blood will stay in the ventricle itself. Normal end systolic volume is 50 ml. But right now, see, end systolic volume, it came to somewhere around 70 ml. Okay, 70 ml. Normal it is 50. Now it becomes 70. Why? Because as there is outflow tract obstruction, stroke volume decreases. Okay, normally this is the difference, right? Stroke volume, there is a lot of difference. But right now, see, what is the stroke volume? See, stroke volume is now very small. The difference is very small. Okay, so automatically stroke volume is also decreased. Why? Because no blood is not going out, so stroke volume decreases. And one more thing, what happened to end systolic volume? End systolic volume is increased. Blood is not going out, lot of blood staying inside the ventricle. Even after the systole, even after the contraction, lot of blood is there. So, end systolic volume increases. Okay. Now, let us discuss about the aortic regurgitation. In aortic regurgitation, what happens? Aortic valve is not properly getting closed. Aortic valve not properly closing. Now, tell me, if the aortic valve is not properly closing, there is true isovolumetric contraction? No. Isovolumetric contraction means all the valves should be closed. Okay, isovolumetric relaxation means all the valves need to be closed. But when the aortic valve is insufficient, okay, usually we say aortic regurgitation or aortic insufficiency. When the aortic valve is not properly closed, there is no isovolumetric contraction. Normally, this is how the isovolumetric contraction should be. It's a straight line. But see, in aortic regurgitation, what is happening? There is no straight line. So, important word I want you to know is there is no true isovolumetric contraction because valves are not properly getting closed. Aortic valve is not properly getting closed. So, there is no true isovolumetric contraction. During isovolumetric contraction, there should only be the pressure change. But right now, see, the pressure is increasing, no doubt, but there is also volume change. Okay, it's not a straight line, it's a curve. Okay, it's a curve. So, that's what I want you to know. So, let's again discuss one by one. In aortic regurgitation, there is no true isovolumetric contraction because regurgitation, because of regurgitation. Okay. Now, due to regurgitation, aortic valve, due to regurgitation of aortic valve, end-diastolic volume, what happens? End-diastolic volume increases. Okay. See, just think like this. Normally, end-diastolic volume means what? End-diastolic volume means the amount of blood. Okay, the amount of blood which is coming into the ventricle, the amount of blood which is coming into the ventricle during relaxation. Normally, from where the ventricle have to get the blood? Ventricle have to think that this is left ventricle. Left ventricle have to get the blood from atria. Okay, but in aortic regurgitation, what happens? Some amount of blood is getting regurgitated back, right? From the aorta, think that this is aorta. Okay, think that this is aorta. Some amount of blood is regurgitating back. Okay, so what happens? So there is inflow of blood from atria as well as there is inflow of blood from aorta also. So, lot of blood is going to come and stay inside the ventricle. So, because of this, what happens? End-diastolic volume. Okay, end-diastolic volume increases because during relaxation, okay, when the ventricle is relaxing, it is receiving the blood from atria as well as during relaxation. What happens? Because of the insufficiency of aortic valve, even blood is coming from aorta. So, end-diastolic volume is going to be increased. Normal end-diastolic volume is how much? 120 ml. Right now, what is the end-diastolic volume? 200. Now you have kept lot of blood inside the ventricles. Now what is Frank-Starling law? Frank-Starling law tells us more the end-diastolic volume, you stretch the ventricle more. You put more, see, Frank-Starling law is, let me write it down here. Frank-Starling law. What is Frank-Starling law says us? Frank-Starling law says us end-diastolic volume directly proportional to the stroke volume. If you keep more blood in the ventricles, ventricles contract more powerfully so that stroke volume increases. Okay, this is the Frank-Starling's law. According to Frank-Starling law, you keep more blood inside the ventricle. If you increase the end-diastolic volume or if you increase the preload, automatically stroke volume increases. For example, let me tell you. Normally, how much blood you are going to keep inside the ventricle? You are going to keep 140 ml inside the ventricle. Okay, that's just a normal end-diastolic volume, right? 140 ml. If you keep 140 ml of blood inside the ventricle, how much will be the stroke volume? For example, 80 ml will be the stroke volume. Now, if you keep 200 ml here, how much will come out? Almost 120 or 130 or 140 will come out. Means if you increase the end-diastolic volume, automatically stroke volume increases. Automatically stroke volume increases. So in the same way, the same logic applies here also. Because of the regurgitation, what is happening? Because of the regurgitation, end-diastolic volume is going to be increased. When end-diastolic volume increases, stroke volume increases because of the Frank-Starling's law. Please concentrate here. See the increase end-diastolic volume. Okay, we have already discussed why the end-diastolic volume is increased. The increased end-diastolic volume increases the stroke volume because of Frank-Starling mechanism. The more you put the blood, the heart is going to stretch more and it will contract more, which increases the stroke volume. You can clearly see here, right? See, this is the stroke volume in a normal person, but see here, how much is the stroke volume? There is more stroke volume. The stroke volume increases. So, stroke volume increases in aortic regurgitation, true. Stroke volume decreases in aortic stenosis, true. Okay, in aortic stenosis, what happened to the pressures? The pressures are going to be increased. What happened to the end-systolic volume? End-systolic volume increases. End-systolic volume increases. Even here also end-systolic volume increases. Okay, but not that much. So, with this, we have discussed left ventricular pressure volume loops, important points and abnormalities. Hope the video is helpful. In the next video, we will discuss about the jugular venous pressure changes. Thank you.